Hey, hello, my name is Caitlin Johnson, and today I'm going to be talking about nursing shortages and specifically how it relates to rural areas. I am interning with Missouri Rural Health Association, and I have decided to do this topic because it is something I am passionate about, because I want to become a nurse and I want to learn more about how to effectively care for all different types of populations. Okay, so I'm going to be talking about burnout that nurses experience. And so, when a nurse has a reduction of energy, it can lead to a lack of motivation, exhaustion, and feelings of frustration, which can lead to reductions in work efficacy. And as we all know, COVID has definitely taken a toll on our healthcare professionals everywhere. However, this nursing shortage has been around forever. And personally, in my future career as a nurse, I do not want to experience this burnout. So I think bringing awareness to this issue is very important. If we do not do something about this issue, there will be major consequences, especially to the health of individuals. And I have put on here compassion fatigue, which is stress that results from exposure to a traumatized individual. And this compassion fatigue can be overcome by strengthening those interpersonal and communication skills. Low staffing, as we know, can cause burnout among nurses and increase the risk for medical errors. And in my next slide, I am going to show you just how this heavy workload amongst nurses can impact both the nurse and the patients that they are seeing. Nurses who work overtime and being asked to fulfill duties beyond their capabilities definitely experience burnout. And so here's the chart that I was talking about. We can see just how heavy workload impacts both the nurses and the patients that they are seeing. So there may be less time that is spent with patients when these nurses are overworked, which can cause poor treatments for the patient. As well as a nurse may be so busy that they are not paying close attention to detail, which may cause patients to overuse their medications because they may not understand what they were being told to do. There's definitely more stress when there's more work put on to a nurse. As we all know, we are more stressed when we have more work put on us. And this can lead to medical errors as well for patients because these physicians might be going faster than usual and maybe missing out on information that is very vital. Lastly, a nurse may be more willing to take more shortcuts because when we're overworked, we will experience these shortcuts and because it makes it easier, right? And so when they have additional work to do, these nurses may take shortcuts and it can compromise the care for patients because they are not getting the necessary patient-centered care that they need. Overall, we can see that by having nurses burned out, it is not beneficial for neither the nurses nor the patients that they are seeing. And so here I have 4 different ways that we can help fix the problem of the nursing shortages. And these are all different ways that we can assist the rural areas that may be more impacted by the nursing shortages. Okay, and so the first issue that we are going to address is the WorldTrack Pipeline program at Mizzou. This is one of the solutions. So the program was designed to help address the physician shortage in rural Missouri by recruiting and motivating a healthcare workforce that is committed to underserved populations. It begins with Bryant Scholars pre-admission program for undergraduate college students who have a rural background and an interest in becoming a physician in a rural area of Missouri. Over the past 20 years, this program has successfully produced rural physicians for the state, and it is a great program to get more students overall working in rural areas and help improve the amount of workers that are in the area. All right, and a second solution that we can look at is the Missouri Primary Care Association. And this is all about finding a supportive community for those healthcare workers, and it helps them find a community that fits their personal and professional needs. Its focus is on increasing Missouri's primary care workforce in rural and underserved communities. The initiative is Missouri Health Professional Placement Services, and it is all about devoted to rural and underserved areas. It assists communities with recruiting and retaining dedicated healthcare providers. And this is a great way to help combat the nursing shortage in rural areas. The third way that we can help fix this issue is by looking at the different repayment programs for students. And so on this slide, I have 4 different programs that I am going to be talking about, and they are all designed to increase access to healthcare for Missourians and health professional shortage areas. So the first one is the NSL, and this awards funding for eligible expenses to qualified students pursuing careers as licensed practical nurses in Missouri. The second one is the NLRP, and this again awards funding for the repayment of eligible educational loans for qualified registered nurses and advanced practice nurses in Missouri. The SLRP awards funding for the repayment of loans for qualified health professionals, physicians, dentists, and psychiatrists in Missouri. And the last one on here is PRIMO, which awards funding to qualified students pursuing careers as licensed primary care physicians, dentists, dental hygienists, and psychiatrists. All right, and then lastly, I'm going to be talking about how community effort is important in helping solve the issue of nursing shortages. So community involvement is an important factor to think about when talking about the nursing shortage, because the shortage impacts everyone. It does not just impact one individual. So by working together and communicating our concerns with each other, we can all be a voice for change. And in order for the nursing shortage to be addressed, we all need to spread awareness and advocate for change in the healthcare field. So specifically, how does the nursing shortage impact areas such as rural Missouri? All right, well, a study from researchers at the University of Missouri Sinclair School of Nursing found that 31% of nurses in the state of Missouri were 55 or older. They found that rural counties experience nursing shortages at a greater rate than urban counties. And so rural Missouri has had the highest percentage of nurses that are nearing retirement. So this nursing shortage problem is further complicated by the large number of nurses that are now retiring from the workforce. This means that less nurses are working in this area. We need to recognize this aging population and how it can impact the health of those individuals that are living in rural areas of Missouri. And so I've also attached on here the logo for MRHA. So Missouri Rural Health Association's mission is really all about helping improving the health of those individuals that are in rural Missouri. And so here are some benefits to fixing the issue. There are lots of benefits, but the main ones are increasing those number of nurses that are working in rural areas. A shortage of primary care providers makes it difficult for those low income, uninsured, and geographically isolated Missourians to receive the necessary health care that they need. By working with providers and communities, access to care can be improved for the underserved populations. Patients will also have greater satisfaction when their nurses are able to provide them with patient-centered care and they are not burnt out. They cannot provide the right care when they are burnt out. So this is an important issue that needs to be addressed. All right, and so lastly, I have put on here a call to action. So what can you do now to help address the nursing shortage problem? Well, to help address the problem, employers can adopt team-oriented approaches. So these nurses can communicate their concerns comfortably, and they can also facilitate peer mentoring programs. So these new nurses understand the skills that are currently being used in these hospitals or facilities. And if you currently work in a healthcare environment, you can help create a safe workplace for your nurses and your nursing assistants. You can consider offering healthy meals, fitness programs, or other childcare assistance to support your team in and outside of the workplace, because a lot of nurses can be burnt out because of their other extra activities that they have going on outside of the workplace. And so this can help to reduce the total amount of burnout that these nurses are facing. And I also put on here the AMA, which is the American Nursing Association. And this advocates for healthcare reform and empowers individual nurses to lead change within their organization. So this really allows nurses to have a voice and speak up about the issue that is causing the problem. And they can also help lay a solid foundation for the future. And so without this decisive action, nurses will continue to practice under increased stress, which is not okay. So I thank you all for listening to my presentation, and I hope you will continue to spread awareness about this issue and especially how it impacts rural areas. I have put my email address on here under my contact info. If you guys have any questions, feel free to contact me. Thank you.